Good afternoon, comrades. Isolation Day 9. Making this video straight after my wife has just popped out into the garden. We can indeed count gardens as isolation, but better to stay at least 6 feet apart. What can I say? Turns out that Bozo and I believe now Hancock have got COVID. C19, and they've both got it. Well, I'm not really going to comment too much on that because I guess that's not really, whether they have or not, it's not really something that's going to make a huge difference. I agree that the symptoms could have been faked and everything. Of course I do. Naturally, a big question needs to be asked. How did they get tested? Well, because they're important, obviously, and because they're important, then tests must be made available to them. Yep. Anyway, that much. We now know that because, most likely for the ventilators thing, the email must have gone into Boris's spam folder. So clearly we're not getting those that we could have got. However, cheer up, Dyson, well done, James, and JCB. Nice big contracts coming your way. Look, I don't care how we get ventilators. I really don't care. Bearing in mind that me and a lot of immunocompromised people, old people, people with existing medical conditions might soon be needing them. So I don't care how you get them, Boris. But I do care a bit when some, quote, administrative error has made it less likely that we will get them at the point that they are needed the most. Good thing? Yeah, and I will put this as a good thing in here. Went out yesterday evening, and we cheered the NHS on the street where I live. I make no bones about that. Of course, I understand that the NHS has been deliberately defunded, cut to the bone, hospitals closed, ICU units closed, GP surgeries closed. And those that are left kind of rammed with more and more patients, more and more demand. Of course I understand that. We were telling you that before the great British public elected Bozo. Yeah. Also, we were telling you, weren't we? Public services cut to the bone. District nurses, carers, community workers, youth workers, cut to the absolute bone. Yeah. And now the police force that are trying to implement lockdown already cut to the bone. Obviously, what's the crisis exposing? Well, obviously the reality of Tory cuts and massive inequality, and how people who are already very, very rich, very powerful, are going to be able to have all the treatment they need, and of course it's all going to be private. Don't think for one single moment if Hancock needs a hospital bed, if Bozo needs a ventilator, they will be privately provided. Do you honestly suspect that even if he wasn't Prime Minister, and even if Hancock wasn't Health Secretary, do you ever expect that they would rely on the NHS? I mean, seriously, would you ever expect that? Of course not. Like most rich people, they will be privately treated. Now, I'm going to end this one in a couple of minutes now, yeah? As for people who are saying, well, you shouldn't have cheered all of our NHS workers and whatever, and I do mean all of our NHS workers, as I've told you many, many times, my son is an ICU nurse in the Midlands. I am glad that I cheered them. I don't for one second think that they should, I don't for one second support their being underfunded and underrepresented, but I'm glad I cheered them because I have the greatest of respect for them. And I believe that they are doing a incredibly difficult job, under-resourced, underfunded and underpaid. Finally, another plea. Yep. Even though we're getting Nightingale Hospital going and whatever in London, and the units are frankly going to spring up in other places because they're going to be needed. Yeah. Please, Johnson, any of you, even billionaires out there, trillionaires out there, even Jacob Rees-Mogg, still living in the 19th century, get proper PPE out to our frontline medics now. Spend your billions. Give something back to society that you have taken everything out of for most of your lives. Give something back. Use your delivery fleets, your vehicles, your transport. Deliver PPE to our frontline services. They're pleading for it. And as the pandemic is going to peak, the problem is the more of them that get sick, the more they have to self-isolate, the less there are to deal with us who need hospital admissions. While I'm at it, of course, free Palestine. Yep. Anti-Zionism is not anti-Semitism. And if we think we've got it bad here, can you imagine how it is going to be for the people in Israeli-occupied Palestine? Keep the faith, obey the lockdown, look after yourselves, support each other, be for each other and be for communities. Yeah? Speak out and stay strong.